Hello, I'm Dr. Seeta Ramamurthy Pal, working as a fetal medicine consultant at the Institute of Fetal Medicine, Kolkata. You know, the human body is made up of 23 pairs of chromosomes, and sometimes the baby is born with a genetic defect that is either related to the baby having mental retardation, as we call it in layman's terms, or something called thalassemia, which can affect the baby needing blood transfusions every month because the hemoglobin is not being made in these children. Now, these are genetic conditions which affect the fetus if the mother or father has some gene. That is, every person has two copies of a gene, and if one copy has some problem, and if the father also has the same problem in that gene, then that can cause the fetus to have a major problem. For couples who are married within the family, that is, if they are married within cousins, or if they've had any family history of somebody having the genetic problem, it can be transmitted to the pregnant baby, and these need to be checked before the lady gets pregnant, because if that is a problem, or if there is a previous child who has a problem with any specific defect, like the baby cannot move, the baby has problems, and these are not just plain polio or anything. They could be related to genetic conditions like Duchenne muscular dystrophy or spinal muscular atrophy that we call it, and these have to be checked, because if the mother or father is carrying a gene that can affect this baby, and even every pregnancy the baby can get affected. So if you have any children who have such problems, or anybody in the family, please consult the fetal medicine specialist or the geneticist before you fall pregnant, because these tests take time and they need to be done before you fall pregnant, so that if we find anything abnormal the minute you fall pregnant, in the first 12 weeks itself, we can do some tests to check if your baby is affected, and then accordingly decide whether you need to take it forward or not. Thank you.